both pieces of information, the Premier's Council report and the leaked legislation, which has been authenticated by the Minister. And I'd just like to say a couple things, because I believe this is a really important, critical time for Ontario and for Ontarians, because they depend on their healthcare system. I want to begin by saying that Mr. Elliott's remarks and characterization of the state of our healthcare system was false and irresponsible. Even the Premier's own advisor, Dr. Ruben Devlin, said yesterday, there's much to be proud of in our healthcare system. Her remarks remind me of a time when a government talked about creating a crisis in education. What is happening in our healthcare system is that families, especially those with frail elderly, children with complex medical needs, chronic illness, are falling through the cracks. When a loved one is sick, it's the only thing that matters. Doesn't matter what kind of car you have, doesn't matter what's happening at work, doesn't matter your vacations, nothing matters more than that person. And I know this because my own family has managed 4 frail seniors through their healthcare needs and are currently doing that. I came here this morning after spending an overnight with my mom. As you know, my mom had a stroke in September. We brought her home 3 months ago, and my 3 sisters and I have been helping her stay in her home with a bit of help. And we're lucky. We all live close. There are 4 of us. Not everyone's so lucky. I see that in my community. Seniors who can't find access to the care that they need, can't find the right path. Young families with children with complex needs who can't find the right path. There is great care happening out there. I know that. I see it. I've seen it through our journey. But too many times people can fall between the cracks, because I've seen it happen to us. And we come from a family where there's a lot of support. So the challenge is, what if the frail seniors don't have that kind of family support? So the Council's report speaks about this and very clearly identifies those things in our healthcare system that need to be addressed. And a lot of it has to do with navigation and pathways. Yet the government's solution is to take all decision-making power and put it in a single entity in downtown Toronto. I've seen this movie before, 1996 to 2003, restructuring, centralization of power and bureaucracy. Our community of Ottawa suffered. They tried to close the cardiac unit at our children's hospital. And the only way that that didn't happen was the community had to rise up in an incredible way. At the same time, they fired 2 volunteer boards because they were advocating for the needs of their neighbors. The Ford government should be building on regional healthcare, not blowing it up. And what's being proposed in this legislation is just that. So the Premier's Council, if we look back at the report, clearly states that people would be better served by community-based care. Again, yet the government is taking away decision-making powers and accountability from communities and parking it here. That's wrong and will be bad for those who need care and their families. The government's draft legislation, which has been authenticated by the Minister, gives draconian powers to the Minister and the board of 15 people. One example, they can force decisions on local healthcare providers with deadlines of 30 days, with no consultation and no right to appeal. They tried this in Alberta. It didn't work. Their costs are higher. In BC, they folded in their cancer care into a larger agency, and their outcomes got worse. It's not going to work. And it will not serve the families of Ontario well. The greatest risk, though, and we've heard talk about privatization, is not who's delivering the care. It's a 2-tier system where you can pay your way to the front of the line. If you have money, you don't have to wait. If you don't, you wait. And there's 3 reasons why I believe this. The first is the draft legislation gives the kind of power to the minister and the board that is excessive. And as I said earlier, draconian. Premier Ford has also said that he's prepared to use the notwithstanding clause. We all know that. He threatened to use that, went to court over the Toronto City Council. So he sees that as a tool, and that's something that could be used to override the Canada Health Act. And third, you have a proponent inside his cabinet, Dr. Marilee Fullerton, who's a proponent of private care inside his cabinet, Dr. Marilee Fullerton. She's been very clear about that. She has a history, and we all know that. I think at the beginning of the last election, that was an issue. She has also been very critical of Ontario's publicly funded healthcare, at one point describing it as being akin to North Korea. All of these things are very concerning. What needs to happen here is the government needs to take a thoughtful approach, build on the strength of communities, build on the strength of regional networks, and we need what I would say is a cautious and deliberate approach to ensure that those things that families need are there for them. Blowing the system up, more people are going to fall between the cracks, and I'll leave it there.